all about reverse pressure softening. Hello, my name's Claire. I'm one of the lactation consultants at Nutrition and Nurture. Sometime when your breasts feel really full, it can be hard for the baby to get a good hold of them, basically, and get that nice deep latch, that secure, the breast being secure in their mouth that we're looking for. Something that can really help is a technique called reverse pressure softening. So it's useful in the early days when you can feel, going on towards engorged. It can help with engorgement sometimes as well. But basically any time when you're feeling very full, and you might notice that the areolar area might be feeling very full. Sometimes the nipple looks flattened. People say, oh, I've got a flat nipple, when actually it's not. It's because this area around here has become so full and swollen that the nipple just isn't protruding much at all. Okay, so reverse pressure softening. I've tried to kind of simulate it using this one by pushing some more tissue up there, but it's not really working. So you'll have to kind of imagine a little bit. But basically, you kind of put your hand into almost a claw shape and pop it over the top of the nipple. So the nipple's in the center and your fingers are all surrounding that nipple. And then the pressure is towards your body, in towards the areola, and you hold it there for about 30 seconds. It needs to be quite firm, because if you think we're kind of pushing some of that tissue and that fluid back towards our body, so you're holding it for about 30 seconds, which is longer than you think it is. And then you would release. And it's quite good then if you can sort of rotate your hand to a slightly different position and repeat. So press in towards your body, hold, counting that 30 seconds. This is nowhere near 30 seconds, but I think you get the message. And then release. And what that does is push some of that tissue and that fluid back towards the body, which can soften the areolar area and allow for an easier latch. And you could be able to tell, because when you try and do a little bit of breast shaping, it should then feel much easier, and you shouldn't feel like you're trying to squish a whole lot of tissue. I hope that's helpful.